my family, my wife and I had tremendous problems in our own immediate family with healthcare, with some catastrophic results. We sensed that there was a deeper, more systemic problem, and we discovered it was in fact true, and it was in primary healthcare, if you will, the degradation of primary healthcare, and if you will, the family physician, family care. And the story goes something like this. Back in the 90s, when governments were facing exponential rises in healthcare costs, they were convinced by economists that it would be a good idea to cut back on the number of doctors in Canada, because doctors equaled expenses. So everybody right across the country adopted this, and in fact cut back medical school enrollments in the 90s and created a family physician shortage. Very quickly what happened afterward, people had a hard time getting a family doctor. They had a hard time on the front lines of medicine. The system changed. The billing system for physicians became one of giving them small amounts of money to encourage them to see lots of people in a day. And the system quickly evolved to one where the family physician had very little time with people, and they spent the day handing out specialist referral slips, so that we were paying doctors X to provide a rushed primary service, and then paying specialists 2X, and the wait list for the specialists started to pile up. This is a formula for fiscal disaster, and it's one that we still face today. So we encountered the problems in our family at the family care level, at the primary care level, so we said, we've got to do something. So we started thinking about a model whereby we could give people the two most important things in healthcare: access to expertise, and most importantly, time with the doctor. Now, being creative and innovative in terms of providing expertise is not necessarily the biggest challenge. The biggest challenge in the Canadian environment was, how do we get doctors to spend more time with people on the front lines of medicine? Because for quite a long time, it's now illegal in Canada to extra bill for physician services, and you can't charge for insured services. So how are you going to support a model that's going to give people more time? So we actually wrestled with that one for quite a long time. That's kind of one of those first points where you say, geez, is this an impossible task? But we carried on. So the first thing I did was begin doing some research. I went to one of the executive health centers. I sat down with a family doctor, because I just wanted to start to learn a little bit more about, in a little bit more depth about primary health care. So, I did one of these assessments. You're probably aware of them. They're very valuable. The early detection, if you will, of disease. I sat down with a family doctor. I filled out lots of forms about history. A lot of people sat down and talked to me about my past, etc. So I finally sat down with the doctor, and the doctor said, so Don, so tell me a little bit about your lifestyle. He said, I see here you like to have the occasional cigar. I said, yeah, it's, it goes really nice with a glass of port, and, I really enjoy that every once in a while. And he said, I need you to stop smoking the cigars. I said, okay, I can do that. So we went on. He said, I see here you like your wine, or you at least drink a decent amount of wine. And I said, yeah, I really enjoy wine. I've been collecting it for a long time. I really enjoy it. My wife and I love to crack a bottle almost every night. And he said, Don, you got to stop drinking the wine, at least for a little while. I said, really? He said, yeah. Right. So I said, all right. He said, what about your diet here? I see you seems like you eat a lot of meat. And I said, oh yeah, I love a great steak, and I really love that stuff. And he said, well, have you ever tried a salad? I said, well, yeah, I like salads. They're not particularly interesting. He said, well, I need you to give up the meat and start eating a few more salads. And I look at him and I say, so you're telling me that if I give up my cigars, stop drinking wine, and start eating salads, I'm going to live longer? And he said, Don, you may not live longer, but it'll seem like it. So, not true. I got a lot of value from my first preventive health assessment, executive health assessment, but I learned a lot of things about prevention in particular, and I learned that it was a key to fiscal sustainability in any model that we would develop. And it wouldn't only be the prevention of physical disease, but it would be the prevention of psychological, disorders and cognitive disorders or brain health. So we started crafting this model, and we knew it was going to have to be very personalized and service focused. We knew it was going to have to be prevention focused. We knew technology would play a role, and I had a medical technology background, so we knew it would play a role mostly in empowering people with their own information. But again, it was really going to require the time and expertise. So we didn't quite know how we were going to put that together. But we started putting together a model. Quite simply, we found a way that we could work within the system but still accomplish the model, a model that would work financially. And it goes something like this. In delivering the expertise, one of the key ways that you can deliver more expertise on the front lines of medicine is engage more types of professionals. Particularly in the area of prevention, people like psychologists, registered dietitians, kinesiologists, exercise medicine specialists, these kinds of people, play a really, really pivotal role in what we would call therapeutic lifestyle change or risk reduction for people. So we knew that that was simple. We could bring the team together to provide that kind of higher level of expertise for the physicians. But most importantly, if we gave the physicians that kind of support, they would simply have more time available on a per patient basis because we knew we could leverage those professionals. So therein lay the model. So we wouldn't charge for physician services. We would charge for uninsured services. We would charge for the services of people that aren't covered by Medicare in Canada, dietitians, psychologists, kinesiologists, nurse practitioners, and those kinds of people. So that's how we constructed the model. But we knew that it was still going to be quite controversial because in Canada we still have this problem with options and choice and investing in our own healthcare. We can buy all kinds of other things, alcohol, cigarettes, anything. We still have this fundamental problem with people being able to get a better healthcare experience than others by paying a fee, regardless of whether or not it's legislatively compliant. So we knew we still had a big obstacle to face. And we also weren't sure whether or not people would want to pay such a fee, because at that time we figured out it was going to cost about $2,300 a year to deliver the service and have a sustainable business. So that was going to be the price to get better primary care. We felt that it was going to happen and people would embrace it, but we weren't sure. We hadn't done broad market research. So this is where the disruptive innovation comes in. We knew that in order to change the model of delivery in Canada, we think we had come up with a formula, a key or a shining light for the rest of the system is this interprofessional model. But we had to create a market that didn't exist. We had to go out and charge a fee for a primary healthcare service that most people feel is a right in Canada. And that was quite a gamble. And again, it's at this kind of point where you again wonder, should I show up for this or not? It's going to be a lot of hard work, and there's going to be a lot of politics. But instead of playing it carefully, we actually played it fairly dramatically. So we decided in 2005 that we would announce, and we knew this was going to be a word that was really going to resonate with the press. We were going to open Canada's first private healthcare center. So, and we did it on purpose. Our heart was very pure in this mission. My wife and I wanted truly to really help the Canadian system, but we knew if we used the word private, it was going to get a lot of attention. And we needed a lot of attention because we needed to see, would this market fly or not? So we leaked the information to our favorite local reporter who put it on the wire, and before you knew it, we were front page news everywhere in 2005. It was estimated at one point that we had received $75 million worth of free advertising in that first week, most of it above the fold across the country. And my wife sat in our living room one night as Lloyd Robertson was talking about us and Jack Layton having a problem in the House of Commons, and all this kind of surreal activity was happening. And we looked at each other and I said, what have we got ourselves into? But we kept. What happened right after that, Decima Research said, wow, look at all this excitement. I wonder if there's a market. And just an entrepreneur's dream, they actually put out a study, huge study, national study, to see if would people actually pay this money and actually show up at this clinic. See, at this point, we hadn't opened our doors. We were just announcing that we were going to do it. We hadn't spent any money and hadn't risked very much at all. So this Decima report said 23% of Canadians were willing to pay the $2,300 a year for that healthcare experience, pointing to an $11 billion market in the country. So we were now pretty excited. So we kept the publicity going, waiting for the tens of thousands of people to show up in Vancouver based on that study. Well, I can tell you that 6 months into it, still hadn't put a lot of money into it, still wondering what was going to happen. We had at least, it had to be 75 people had shown up at the clinic in Vancouver, and we were already constructing and getting this center up and running. So my wife and I again looked at each other. We said, okay, this business model, the plan isn't going to work. It's going to take all of our life savings, et cetera. Are we going to do it? We decided to push the big green button, even though all business indicators were it was not a good idea. But we were committed to the concept. We knew the model was a great model. We knew that it was the key to fiscal sustainability of Medicare in Canada in the long run, and we decided to plow ahead. We decided to show up, is the way I say it. So we went ahead, we put every cent we owned, it's still in the business, by the way, and off we went. Well, within 6 months, we were the subject of the first ever Canadian audit by the BC government for compliance to the Canada Health Act, et cetera, et cetera. This idea for a large, special interest groups in particular in the country did not go over very big, that someone could pay this fee and get this great healthcare experience. And despite its legislative compliance. To this very day, we still face opposition. You may have even read about it recently in the Alberta papers, where there's still pressure to try to restrict this kind of activity, making people healthier, better. It's really rather fascinating. So we endured, and if we look at the situation today, 8 years later, I should point out we started in Vancouver, our first clinic, and then in 2008 we opened up our center in Calgary. And we would have opened it up earlier, but it was a very hard time to get real estate right before then, if you may recall. And it took us a year and a half to find the appropriate real estate. But, and we've come on now. We have a facility in Edmonton now that we opened about a year and a half ago, and another facility, family center in West Vancouver in BC. But 8 years later, if you look around the country, Ontario has some concept called the Family Health Team. It started off as more like the co-location of professionals, but it's gotten much closer to our model. Here in Alberta, the government's announced the family care clinics, which is essentially a version of our model. And so we're starting to see the public system recognizing the value of the idea that we had. And my wife and I today, despite having no retirement savings still, but we do have a growing, successful company, and that's good. But we're very proud of what we accomplished. Now, having said all that, we've been unabashed with our clients about the fact that, they're wealthier people that show up. These are the early adopters of these kinds of concepts. We're successful in our disruptive innovation. We created the market. We now have, by the way, probably 5,000 customers amongst our centers, so we've grown quite well. And it's become accepted. We have competitors, which is fantastic, Competitors are really good in a business when you're trying to create a market like this. So all of that is really good. Now, however, we still recognize, we have a heart in our company. It's the foundation of our kind of value system at Copeman Healthcare, and that is we still want to do more for everybody. Not everybody can afford, at this point, about $3,000 a year for a service like ours. They just can't. So I mentioned technology earlier, and that I came from a technology background. So we had actually gave our clients the first personal health record in the country. And I had developed this concept even before we opened the clinic in Vancouver. Basically taking someone's medical chart from the doctor's office, smooshing the information and giving it back to them to empower them with their own information and engage them as a part of their own health team, if you will. And we developed that way back in 2005. We had it available for our clients in 2007, but in a very, very simple form. But it was very successful. It's used by about 80% of our clients, and it's a way of educating them about their disease risks and those kinds of things. It shows them their values. It helps them keep track of things and helps with their overall wellness plan. It works really well. But we had an earlier vision, and we decided that we'd really invest in, and we've taken most of, again, our earnings over the last few years and developed something called Carebook. So disruptive innovation, number one, worked. It's really starting to reshape how we look at delivering primary health care in Canada. Disruptive innovation number 2 is to deliver a service, meaningful service for health prevention in the country that's going to cost about $20 a year, and is therefore effectively free, because we think governments and companies will pick up the service on behalf of their employees, or in the government's case, on behalf of the population. And what it is, if I could have the slide, please. I'm just going to give you just a snapshot of what. Unfortunately, you can't see the entire slide. Carebook builds the most comprehensive personal and family health record for you, your children, people that you might be caring for in your life. And it puts it online in a very secure way. In a way, we called it Carebook because it's really the Facebook of medicine. I don't know if anyone's familiar with Facebook, but essentially in the Facebook world, you create a social profile, you create events and stories and things that you want to share. But if you don't decide to share them, well, they just sit there for your own enjoyment. But you do want to share them. That's the whole point. In Carebook, you build a complete and comprehensive medical profile that actually is getting feeds from government systems, your doctor's office, et cetera, your own self-entry, and you share it with whoever you want to share it with. In this case, your providers. But we realize in our business that exceptional health care is not just doctor care. It may be your chiropractor, or maybe your naturopath is effective for you. Maybe it's your own personal dietitian, your personal trainer who helps you out, whoever it might be, your dentist. All of these people are part of your healthcare picture. So Carebook is taking your complete medical profile in the most comprehensive way possible, storing it for future use, which is value unto itself, but then allowing you to share it with very specific rules with every person in the healthcare community for you. And it's very easy to operate. But more importantly, it has things like health surveillance. Health surveillance means once the laboratory or measures data gets into Carebook, it will tell you if something is not right. Even if you're one of those unfortunate people who have to go to a walk-in clinic and really don't have people really looking after your preventive health care or looking at trends, things that are heading in the wrong direction so you can head off disease. But Carebook will do this in an automated way. From the time your first child is born till the time that they die at the ripe old age of 115, let's say, they will get a reminder for every evidence-based immunization, test, examination for the rest of their lives. So even if their own family doctor or health team isn't engaged at that level, Carebook will give it to them. It'll give them a complete and accurate assessment of their relative risk for 12 cancers, 4 major chronic diseases, a number of other health indicators to show where they stand against the population and give them the education and guidance on how to reduce risk. So this is disruptive innovation number 2, because guess what? If I showed you a complete demonstration, you'd probably be overwhelmed. It's really, really something exciting. But the governments, again, they like to be very possessive about data. It's very hard to connect to it. It's a very hard product to get off the ground. So here's what we're doing right now. Again, the way we had to approach the first model, we're going to bypass, if you will, the government channel, which is where everyone is kind of going in this space, because we just don't believe it's happening fast enough. We're going to the corporate market, because we know that companies want their employees to be healthy. So there's an alignment of interest, and for $20 a year, it's very affordable for a company to sponsor this for their staff, to get world-class automated prevention, even if they have the best, access to the best physicians. So with our corporate health programs that we already have, with what we believe will be really exponential adoption of this kind of technology within companies, we will populate Carebooks across the country in a way that was unexpected. A consumer-driven approach, helped out by companies. We don't know where this is going to end up. We just released our first version to our own internal staff for what we call a release candidate for the product, but we plan to go to the general market with it early in 2014. But we believe it'll change the world of medicine. Because just imagine when you get a reminder that it's time for your mammogram or it's time for your first colonoscopy, and your own family doctor didn't know you needed one but should have known that, right? So we're not sure where this one's going to end up, but we're taking, again, a disruptive, innovative approach, creating a whole new market and a whole new approach to delivery medicine that's never been done before. We've shown up. So on that note, I'm guessing that I'm probably somewhere around my 20-minute mark, but I don't see any clocks around. But I'm going to bring up my two medals here. So I just happened to be in Europe in last year, 2013. And what I do for exercise is Brazilian Jiu-Jitsu. Anyone know what that is? So it's like, you may have seen on TV, it's where these kind of semi-naked men roll around on the mat together trying to break each other's arms. You know, we all have to have our releases. Anyways, I decided when I was in Europe that I was going to go into one of the World Champion events, which was in Lisbon, Portugal in February, and spontaneously. And I came away with 2 silver medals. Now, the real story is there was only one other competitor, and I lost both of my matches. And so, but it was funny. It's a very popular sport these days, actually. And as the crowd was cheering, asking me to come up and receive my silver medals, I was saying to my family who were with me, I said, I can't possibly accept these, right? It's just ridiculous. But there was legitimate appreciation for and the crowd there was thousands of people, and so I went up to get my silver medal, and I just looked around at their faces, and I realized in a moment of clarity that I deserved the medals. And my middle son and daughter were there, and I gave one to each of them. They lent them back to me, and I said, I just said, here's a simple lesson. If you believe in something and you really want to achieve it, the first step is always simply showing up. So there was thousands of people that could have gone to Lisbon to compete against me, but they didn't, and I ended up with a silver medal, and I'm actually proud of it now, because I actually, and so are my kids, because they got it. I showed up. So if there's a lesson there, it's in what I have to say is that sometimes things seem immensely challenging, but if you really believe in them and you really want to see them through, just show up. It's got to start there. Thanks very much.